Senator Brown, you were next, and then I very much want to get Senator Casey in very quickly, but if we kind of keep breaking this up, it's going to be bedlam here. Senator Brown.
Thank you, Mr. Chairman. Mr. Witty, welcome. Glad you're here. In addition to being a large insurance company, UHG also owns and operates a PBM, as you know, Optum Rx, which tells you a lot about the problems going on in our healthcare system. I hear from so many independent pharmacy owners in Ohio who are forced to make impossible decisions, including considering dropping out of Medicare Part D, even having to close their doors entirely. A couple who runs 5 pharmacies came to me. They've shut down because of PBMs. The same story, driving up costs through abusive practices like imposing punitive direct and indirect remuneration or DIR fees on pharmacies. Were you aware, Mr. Witty, that in a recent National Community Pharmacies Association survey of independent pharmacy owners and managers, over 1/3 reported they're considering closing this year due to financial constraints? Are you aware of that?
I am certainly aware of similar research, yes.
Okay, thank you. Do you acknowledge that PBM played a significant role in at least some of those closures?
So thank you for the question. From our PBM at Optum Rx, we're actually, for example, we do not have DIR fees. We are not doing any.
Back to the question. Do you acknowledge that PBMs play a significant role in some of those closures?
I don't necessarily believe that to be the case. I think the PBMs provide a very significant service in a variety of support to clients who are looking for.
Well, sorry to cut you off. I have only 5 minutes. It's clear that DIR fees contribute to local pharmacy closures. As I said, I just met with 2 Ohio pharmacists last week, forced to close their stores. They are in rural areas, 5 pharmacies in 5 different communities where those people in those communities will have to drive at least 5 or 10 miles. They had record sales, but PBM practices meant they can't even break even. It's clear that the PBM your company owns is making massive amounts of money. You know that. I assume you've probably bragged about that. Last year, PBM reported revenues of $116 billion. So it's pretty clear you could eliminate those fees and still be making plenty of money. Will you commit today in front of the Chairman Wyden in this committee to lower and, when possible, eliminate DRI fees to save community pharmacists in Ohio and across the country?
Senator Brown, we have already eliminated DIR fees and absolutely
Will you help us in the industry convince some of your colleagues to do the same?
To the extent that we're able or allowed to do that, we will certainly encourage that direction.
Okay, it's clear that a number of PBMs are not going to reform on their own. It's why we urgently need to pass this legislation, Mr. Chairman, to rein in these corporate middlemen, and we need to pass it this Congress. Moving on to something Mr. Langford was talking about, this cyber attack put a financial burden on the doctors and hospitals, pharmacies, and health systems in Ohio due to disrupted payments, and particularly community health centers are facing some of the most dire consequences from this attack. You know how important community health centers are in Pennsylvania and Ohio and Idaho and Oregon. They serve patients, often the most vulnerable. They operate on slim margins. There's a health center in my hometown of Mansfield, Ohio, whose revenue dropped from an average of $600,000 a week to under $200,000 a week due to this attack. Unacceptable, of course. Health systems can't continue to operate like this without certainty that they'll be compensated for these kinds of losses. What is United's plan to compensate providers and health systems who are bearing these additional financial burdens because of this breach?
So thank you for the question. So in the context of the family health center you describe in Mansfield, in that situation, we have our interest-free loan program. Over $2 billion have gone to family health centers like the ones you describe, and we'd be very happy to reach out to your office. And if that particular provider has not yet taken advantage of that program, it is still available, and it would bridge the gap in the cash flow that you described.
And these loans, though, will be required to pay back?
Only when they are fully back to normal and all backlogs have been cleared, and they, not me, but they confirm that their cash flow is normalized.
They will make the determination of back to normal?
Correct, and then they will have 45 business days to then start the repayment, so 2 calendar months.
And low-interest loans precisely means what?
No interest, no interest, no fee.
Thank you.
Senator